This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday. Thanks for joining us. I'm Kyle Wigg sitting in for Dave. Dave will be along at the top of the hour with Talk of the Town. He'll also be hosting Talk Line today. Our guest today on Mon Health Talk Radio, Katie Davison, Chief Human Resources Officer for Mon Health Systems, and Nate James, System Director, Employee and Workforce Engagement. And both of you have been frequent guests on this program. First of all, Katie, good morning to you.
Good morning. How are you doing today?
Doing well. And Nate, thanks for coming back on the show. We appreciate your time.
Good morning. Thank you for having us again.
So what we're going to talk about today is the Explorer program at Mon Health. So let's take a moment and define that. Katie, do you want to start? What is the Explorer program?
Absolutely. The Medical Explorer program is a partnership with the Mountaineer Area Council Boy Scouts of America, which is now known as Scouting America. And so it's a branch of Scouting. And what it's really serving is to get younger kids interested and exposed to careers in healthcare. So it's something where if you're a youth anywhere age 14, even up to 20, so we do have some folks that have just graduated high school and are trying to figure out that next step. It's a way that the local hospital can partner with Scouting to help get that exposure, get some real hands-on experience. And then for us as an employer, it's a great way to really cultivate, hopefully, our next incoming group of employees.
And Nate, what can you add to that?
Just excited about the program to start. We have some major benefits that we'll talk about later in the show, but really just excited to be one of the first Explorer programs in the Northeast region here.
Nate, who is eligible for this? Katie talked about the fact that it's Scouting related. You're affiliated with Scouting America, but in terms of age and other qualifications, who is eligible for this?
So really anybody from the age of 14 to 20 years old is eligible to attend the Explorer program. We have it here at the Medical Center here in Morgantown, but we are open to everyone in our local community.
Okay, Katie, is this a one-time event or is this something that continues on?
This is going to be hopefully something that we continue on. We just started our first cohort at the end of last month, and we do plan on opening up a second one and then continuing it onward for as many students as we have interested. We are going to be starting as the school season starts up at the end of summer, early fall. We will be very present throughout our local schools to promote the program and hopefully garner more interest and continue to have students year-round.
Okay, you mentioned you had an event at the end of last month. So what was that like? What was the experience like for these young people? You mentioned ages 14 to 20, so teenagers through into young adulthood. What was it like? What was a typical day like for them?
So we had them start out with a tour of the hospital just to get a good sense of what we do at Mon Health Medical Center, all the services that we offer. And then our very first learning experience was with the radiology department. So the students spent some time in the classroom with the director of radiology, really getting a good solid background of all of the different elements of radiology. We have CT, we have ultrasound, mammography. So getting to understand all of the different components that go into the radiology department. And then they got to experience a lot of hands-on exposure. So they went to the radiology department, got to x-ray some fun items like a cell phone and some other things to really get to see kind of internal workings of how x-rays are taken and get that learning experience firsthand.
Okay. Nate, how many youngsters took part?
So currently this first cohort, we have 7. Excited to say for our second cohort that will start in August of this year, we currently already have 5 individuals that are interested in the program.
And Katie mentioned radiology for the first go around. Are you taking these individuals to different parts of the hospital?
We are. So each month we will focus on a different department and learning experience for these students.
Okay. We'll talk about that. What are some of the benefits? What do they get out of this? What do they take away from this program? Nate, we'll start with you.
Yeah, so I think the biggest thing for these students to learn is just providing a hands-on experience and exposure to various healthcare professions. A lot of individuals this age may not know everything that healthcare has to offer. They may just think it's a nurse or a physician, but we like to teach children that it's more than that. We're a small city within the hospital, so we have all of the functioning departments such as IT, human resources, housekeeping, food and nutrition. So just giving them an experience to see that what healthcare has to offer. It also fosters teamwork, leadership, and communication skills and gives them the opportunity to collaborate with peers in the healthcare profession. So giving them networking opportunities as well to build them relationships that could be beneficial for their future education and career endeavors.
Yes, you talk about teamwork, and Nate, we'll stay with you. It's an opportunity. Okay, radiology, the different jobs, the different aspects, the fact that everyone in that department has to work together to keep it efficient and to keep things going. Talk about that a little bit, the teamwork aspect.
Yeah, so just harboring that teamwork. So we know that for a lot of our patients that come in, the nurse is the front foreperson, but behind the scenes, radiology, laboratory services. So these individuals need to do their jobs so our nurse and physicians can properly diagnose the patient and treat the patient for whatever they come in for. So just harboring that teamwork to show that, yes, you may not see it because they're behind the scenes, but everyone is working together for the betterment of the patient.
Katie, what's up next? Was radiology the first time? Do you have an idea what the students will be exposed to during the August session?
I believe we have nursing coming up next, which will be a really exciting one because it encompasses so much of our healthcare workforce. And so a big piece of that program is going to be also educating students that there's no one-size-fits-all when it comes to nursing. And that's really also the beauty of a nursing career, is that you can work in so many different areas and have different functions, whether it's at the bedside, whether it's in a specialty service like emergency or critical care or surgery, or there's other areas of nursing like our quality nurses that help with keeping our patients safe and do audits and making sure that we're compliant with regulatory standards and improving the patient experience. And then there's also areas such as our education services where we have nurses that specialize in educating other nurses. So it's going to be, again, a really big platform to showcase all that nursing has to offer and hopefully, again, garner some interest for students to pursue that as a career.
Katie, the first time around when you took this group of students through the radiology department, when it was over, did you get a chance to speak with them and debrief them, so to speak? What did they tell you about the experience?
I think there was a little bit of that kind of wide-eyed amazement. It was something where it was a lot of aha moments, like, oh, I didn't realize that, that happened, or that this was really what you see. And so I think it was something that was, a nice eye-opening experience of really what goes on behind the scenes, and they seem to appreciate and get excited for the next session.
We are speaking with Katie Davison, Chief Human Resources Officer for Mon Health System, Nate James, System Director, Employee and Workforce Engagement with Mon Health. We're talking specifically today about the Medical Explorer program at Mon Health. They're working with Scouting America to bring in young people and teach them what goes on behind the scenes at the hospital. And one of you said you talked about it being its own little city. And I mean, that's absolutely true. I mean, you've got there's so many different aspects to a hospital. Just take a moment, Nate, and tell our listeners about that. I mean, most people have been through the hospital. They see what goes on. But in terms of having its own little infrastructure and being its own little city, I think that's very profound.
Yeah, so our president and CEO, David Goldberg, always talks when he's speaking with new individuals about really defining what that city means. So we basically have all of our departments working incoherently together to betterment for patient, visitors, and staff. So we could not function without every single department working together in our hospital to be successful.
Katie, anything to add to that?
Yeah, I will share. I think I can be living proof of the fact that, where you think you might want a job in healthcare and you never know where you're going to end up. I was actually a medical explorer when I was growing up. So the community where I lived had a medical explorer program, and it was and I started when I was 14, and it was the first experience I had to really volunteer in the hospital and get exposed to all of the great things that healthcare had to offer. When I was at a young age, I thought I was going to be a doctor, and that was my plan. And I, graduated, went to college, and still kept that connection to exploring, and found out quickly too that while I wanted to work in healthcare, it was a better fit for me in terms of some of the things I saw, that I wanted to be in an area that could help people, but necessarily didn't have to be hands-on with the patients. I think that's a very important experience for these students as well, is part of any internship or like this exploring program. It's important to find out what you like and what you're passionate about, but also what maybe isn't, what you thought it was. And that, we have some folks that might come through that think they want a career being a physician, but maybe they don't like the sight of blood, and you don't know that until you're in that experience. So it's something where we want to provide that robust approach, that if you have that natural instinct to help others, and you come from a giving, heart, and that you want to help your community, that we have a place for you in healthcare. And I think, for me, my path led me down to, human resources, which is something where I always talk about how we provide care for the caregivers, that we are here to hire well, to support our employees with great benefits and compensation, help them grow professionally throughout their career, and then on to hopefully retirement with our company. So it's something where I feel very fulfilled being in healthcare, even though I'm not in a hands-on type of position. And Medical Explorers really helped me get to that point now, 20 plus years into my career. So we're really hoping to recreate that experience for our students in Mon County.
Well, that's a great story. So you start as a medical explorer at the age of 14, and here you are with a career in the medical field. That's really a great story. Katie, if people are listening, if they've most of the kids are in school, so the young people aren't hearing this, but if they're a parent, I'm sure they can check out the podcast eventually. But a parent or a grandparent or an older sibling that hears this, that wants their children to be involved, how do they go about that?
Nate is our contact person, so I'll let Nate share his information and where they can go to find out more or to apply for the next cohort.
All right, Nate, you're on.
Yeah, so they can call me directly at 304-598-1324, or they can also email me, and I can send all information to them at nate.james@vandaliahealth.org.
All right, so contact Nate. Again, that number is 598-1324 if you want to get involved in the Medical Explorer program presented by Mon Health. We'll take a break, and we are with Katie Davison, Chief Human Resources Officer for Mon Health Systems, also Nate James, System Director, Employee and Workforce Engagement. We'll take a quick break. We'll continue the conversation on Mon Health Talk Radio for this Monday, after this on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk continuing for this Monday on WAJR. Thanks for joining us. And we are joined by Katie Davison, Chief Human Resources Officer for Mon Health Systems, and Nate James, System Director, Employee and Workforce Engagement. We spent the first segment talking about the Medical Explorer program at Mon Health. Fascinating. And Katie told the story about how she was in the Explorer program at the age of 14, and it led to a career in the medical field. So very, very interesting there. And it's a program designed for young people to see if they would like to pursue a career in the medical field. Guys, we have a few minutes, and I want to talk a little bit about employment at Mon Health, the Mon Health systems. And Nate, first of all, I would imagine there's always opportunities, right? If there are jobs available, how do people find out what jobs are available and the process of getting started to take that step towards employment?
Yeah, absolutely. So we do have our careers website at monhealth.com/careers. We also have an HR recruitment email that they can always email about opportunities. And one of our famous recruiters, Guy Stewart, is always out in the community promoting jobs here within Mon Health.
Mm-hmm. And Katie, the process of reaching out to the community, and again, getting the community involved, whether it is employment or volunteers, right? You're always looking for volunteers.
Oh, absolutely. We have a wonderful volunteer program at Mon Health Medical Center, as well as our other facilities, so Preston Memorial and Stonewall Jackson Memorial Hospital. And we are always looking for people that are able to just lend a hand. And it could be, just a few hours a week, or if you have the availability and want to help out more, we have needs throughout our hospital. We've got volunteers that work at our guest services desk, help greet people, help them find their way throughout the hospital, get to their appointments, as well as helping out in our gift shop. We have so many opportunities and just a need for community helping community. So Nate's also another great point of contact for anyone who just wants to know more opportunities regarding volunteering. They can start with Nate, and he'll get you pointed in the right direction.
Okay. Nate, what areas do you need volunteers?
So we have a wide variety. Our favorite spot for our volunteers is our infusion center. So this is helping individuals that come to provide for the infusion services. They provide everything from warm blankets to just a friendly conversation for an individual throughout the day. We also, as Katie said, are guest services. So we're always looking for our receptionist desk. So whether it's at the front desk in administration, we have an individual that sits in our Surgicare North and Surgicare South. Just an individual being there to help families navigate throughout the hospital.
All right. And that process, you mentioned a little bit about people who are looking for employment. What about folks that want to reach out to the hospital and offer their services as a volunteer?
They can reach out directly to me as well, again at 304-598-1324, or by email, nate.james@vandaliahealth.org, and I can get them started with the volunteer process.
All right, very good. One final thing before we wrap this one up. You guys were sent here to speak specifically about the Medical Explorer program. And Katie, I know you mentioned the next one's coming up in August, and it looks like it's going to be a focus on nursing. So what about the future of this program past the one in August? What type of opportunities would you like to present for the young people interested in getting involved in this program?
Well, we've got a number of features coming up throughout the rest of the year. We are going to be highlighting and getting some experiences in our lab, as well as surgical services, cardiology, as well as some of the back office functions. So we think it's important as well to expose the students to what it takes to keep a healthcare system running. So we want them to understand, what does our IT department do? What does HR do? Accounting, finance, all of those things that are very critical to helping an organization, a hospital run. So that's going to be kind of our pathway for the remainder of the year, is just really focusing on different departments to highlight. And then moving forward, we would love to branch out and have our medical explorers also be assisting with our junior volunteer program, which is geared towards young adults volunteering at the hospital, as well as, Scouting's mission is always about community service. So we would love to partner with the youth as well as we do community outreach programs and get their assistance to also kind of showcase what it means to be the community provider for healthcare in Mon County.
Mm-hmm. Nate, did we cover it all today?
We sure did.
And you're the point man, right, for these programs, 598-1324. That's the number to reach Nate James with the Mon Health Systems.
That is correct.
Very good. Nate James, System Director, Employee and Workforce Engagement. Katie Davison, Chief Human Resources Officer for Mon Health Systems. They've been our guests on Mon Health Talk. Thanks for coming on, guys. We appreciate the information.
Thank you so much, Kyle.
Thank you for having us.
All right. Thank you.